It happens to all of us. We're going about our day when all of a sudden we get a hiccup. Why do hiccups happen? Well, short-term hiccups are generally caused by drinking carbonated beverages and too much alcohol, drinking hot liquids, overeating, eating too quickly or eating spicy foods, emotional stress or excitement, sudden temperature changes, or even swallowing air. We can't avoid all these causes, but we can take steps to limit our exposure to them. However, not all hiccups are short-lived. Rarely, hiccups can last for months. If your hiccups last over 48 hours, they may be linked to things like certain medications, alcohol use disorder, diabetes, electrolyte imbalances, kidney disease, barbiturates, anesthesia, steroids, tranquilizers, hepatitis, pneumonia, tumors or stroke, or any disease or illness that irritates the nerves that control the diaphragm. Whatever the reason for the hiccups, there shouldn't be a reason for concern unless they are persistent or disruptive. Generally, the best thing to do is just be patient, though that's easier said than done.